Hey guys, just jumping on. I hope you can hear me. If you can, let me know. This is an unscheduled live, but I'm jumping on because I wanted to find out what you guys think about starting your medical billing business while working a full-time job. Are you ready? Do you want to go from being a biller to being a billing business owner? And what is stopping you if you aren't ready, if you haven't started, if you've been thinking about it and have not started? What is holding you back? Now, that is a question that I'm asking you guys. Drop a message in the comments section and let's talk about it, because I get questions about, wanting to start a business, but I want to know why you haven't started it already if you wanted to. I also wanted to remind you guys that I do have a free quiz that you can take to, maybe give you an idea about if you are ready to start a medical billing business. So I will make sure to drop the link to that in the description box. Actually, it should probably have it in the description box, but I'll drop the link for that in the description box. And I also have a free checklist, a free medical billing business checklist, because some of the people that I've spoken to have said, well, they don't really know where to start. So that's one of the reasons why they haven't started. So I have also done a free medical billing business checklist, so you can make sure that you download yours. It's still, available to be downloaded, but there will become a point where it probably will not be. And right now it's for free, so catch it right now while you can. Get that free medical billing business checklist that can just guide you to starting your medical billing business. Now, again, if you catch this on a replay, make sure you drop a comment. Let me know what is stopping you if you have been thinking about starting a medical billing business. What is stopping you? I know for me, I can say that I did start my medical billing business like officially in 2019, I think it was. But I have been doing 1099 contracting work since 2008. So yes. Hi, guys. Hi. Okay, you're jumping in. How are you? This is going fast. Please forgive me. I don't have the best eyes. I am 45 years old. I don't have the best eyes. So if I don't say you guys' names, it's because I probably can't see it. I should have brought my glasses. I'm so sorry. But hi, everyone. How are you doing? Are you guys, are you getting off of work? Like I said, this live stream is a unplanned one, but I know a lot of my viewers are also full-time workers and they're interested in becoming medical billing business owners. So tell me what is stopping you from doing that, and maybe I can help and assist. I have a checklist, a free checklist that you can download for right now. It might not be free all the time. And then I also have a quiz, a free quiz that you can take. Have you guys taken the quiz? Has it helped you out? Let me read some of the comments. The One Piece is real. Okay, I think everyone is just saying hi. So yes, so drop in the comments. Let me know what is stopping you. So I know for me, what was stopping me first and foremost was fear. I just wasn't sure where, what to do, if I was able to do it. Like, even though I was a biller at that time for probably, I don't know, over 10 years, I still felt like I didn't know enough. Is that what's stopping you guys from, starting your medical billing business? Or is it that you feel like you need to quit your full-time job in order to do that? Because that's another thing. Lately, we haven't been having a lot of people say, quit your job, quit your job. And don't get me wrong, if you want to, if you're hating your job, if it's something that you just don't want to do, then quit. By all means, if you feel like you can, you've saved up enough money, you feel like you can just go out there and start your business, then do that. But don't let anyone make you do that, because you don't have to quit your job in order to start your entrepreneurship endeavors. You don't have to do that. And if you are a biller who's working as a biller, you can work as a biller and still have a business on the side. And I'm going to be doing a series about that because, again, I don't think many people know that. And so they feel like, well, in order for me to do this billing business, I have to quit my job, and maybe they're not comfortable in doing that right then. So, I get that. Where is the quiz? Oh, the quiz. Okay, yeah, the quiz it will be in the description box. The link, it should, well, I don't know if it's already there. When I have lives, it might not be there, but right after this live, I'm going to put the quiz in the description box, and I'm going to put the free checklist in the description box as well. So these lives on my phone, which is what I'm doing on my phone, I usually schedule my lives, and I just kind of jumped on here because I wanted to talk to you guys. So I will make sure to drop that in the description box, the free quiz and the free checklist. What is step 1? Is fear one of the... Yes, okay, so, give me 1 second. Let me get my glasses because I can't see these comments. So this is when you do impromptu live. So what is stopping me is fear of marketing to providers. Okay, fear of marketing to providers. So that, I can understand that, because sometimes you feel like providers are, they are bigger or know more than you. I'm going to tell you from experience. Providers are people just like we are. I know me saying that might sound cliche, but it is totally the truth. And when it comes to billing per se, if you are a biller, billing is your specialty. That's your expertise. The doctor, their specialty is, doing whatever specialty they're in. If they're an OBGYN doctor, if they're mental health, that's their specialty. But billing is your specialty. So just remember what it is that you know and how you can help them. They are looking for us for answers, right? So they may know a little bit here and there about billing, but they did not go to school for billing. When they become a doctor, they are not learning billing in school. They don't know necessarily what to do. So they're looking for you to do that. So you don't have to be afraid to market to them. And let me tell you something. To be honest with me, I don't think I'm a good seller. I don't like to sell people stuff. I don't like to feel like I have to try and convince somebody to buy something or, work with me. And mostly 98% of the providers that I have are my clients. They are referred to me from other people. So I didn't even really have to try to convince them to go with me as a biller, And when I talk to providers, I just talk. I talk and I say what I know. I think you guys could see how passionate I am about billing in general. And that's how I talk to providers. I just tell them what I know. And they say, oh, wow, you seem like you know this. This is great. I have a problem with that. And I just talk to them. So just try not to make them seem much more bigger than you are. We are all on the same level. They are doctors. Their specialty or expertise is to take care of patients. We are billers. Our specialty is billing. Okay, they have no soliciting policy in my town. Oh, okay. Well, you don't have to, and soliciting. I guess that, I would think that maybe that is different from marketing. You know what I'm saying? And maybe you can even do something like go to places where providers would be. I don't know if maybe you have any places that have networking where, I don't know, health summits or seminars or even your own doctor or your child's doctor, your husband's doctor, your mom, dad's doctor, you can just say to them, you're in the office. Now, my mom and my dad is at an age where I go to the doctor with them. And sometimes like I will be talking to the doctor, asking questions, and maybe the way I ask questions or certain things that I say, I have had doctors say to me, "What do you do?" And then I say, well, I'm a medical biller. I do such and such. I have a business. Da da da. And we start to talk like that. You don't have to always look at it as you're just trying to push, 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 or sell, sell, sell to them. So use different avenues to market to your providers. Like I said, talk to your own provider. Let them know, well, I started my medical billing business, or I'm starting. And if you know anybody who need any billing services, they might say, well, I need billing services. I'm having problems with this denial and that denial. And also try to give them free advice, something that can help them right then. Say, well, if they say, I'm having problems with this eligibility issue, I have a lot of patients that, we get the claims denied because or rejected because they're not eligible. And then you can say something like, oh, well, how do you deal with eligibility at the front desk? Do you check eligibility every time the patient comes in? And you just talk to them. They love stuff like that. The same way you don't like to be sold to, they don't like to be sold to either. So you're just telling them what you know and how you can assist them. You're not really asking them necessarily for their business. You're just helping them out. And I think that can help at least get you in the door. Now, I'm not saying that you don't have to do any paper, like ads in the paper and all that stuff. But to be perfectly honest with you, I have never done that. And I have done some ads on Facebook, and that did get me one client. But I don't really like to do that either, because for providers, they like to have that type of trust, and they need you need to build some trust with them. And that's whether or not you are in front of them and they can feel that through you, or they know somebody that they trust. And so since that person trusts you, then they trust you. It's kind of that type of thing. And I'm going to be doing a video about that. That's going to be coming up, I think, like next week or this week or something. But yeah, there are several ways to market, and it doesn't have to be the sleazy way of marketing. Well, lucky. Okay, and I guess you were talking about me getting the clients through word of mouth. And it's true. I am blessed. I am a child of God, and I am blessed. So I do agree with you to an extent. But the other part of it is that I do good work, and I try my best to do good work all the time. And I think people can see that. And so then that's why they are referring others to me. I have never asked anyone to refer. And like you said, I've been blessed to not have to do that up until this point, especially also because you guys know I work a full-time medical billing job, and then I also have my medical billing business. So there's only a certain amount of clients that I can, take on at one time. I can't take on a whole bunch of clients unless I decide I want to, whether quit my full-time job, hire more billers or anything. But I'm not at that point. I don't want to do that right now. So I only can take a certain amount of clients. So if I was trying to get like 20 clients in the next 2 months, then I probably would have to do like a big advertising push, go out more, network, and all of that stuff. But I'm not trying to do that. And I don't think you would be trying to do that either. If you're just starting out, you're like I said, still working full time, or maybe you just lost your job and you're just starting out, you might not be trying to get 20 clients all at once, And I know the first client is the hardest client to get, or you can kind of feel like that's the hardest client to get. But I would really say, be yourself, talk to them, try not to sell them anything like that. They don't want to hear about all the things that you know. They just want somebody who's going to help them with their billing. Right now, I'm studying for the AAPC exam. Okay, great. How is that going? I have gotten several. Like I have the billing certification, and I have the coding certification, and I have the practice management certification. But I think certifications get very addictive, and so you keep wanting to get. Oh, and I have the instructor, certified professional billing instructor certification as well. So I think you kind of get addicted to those. But how is that going for you? Have you done press releases? I haven't done any press releases. What have I? Press releases. No, I mean, I like lately since I've been on YouTube, I would be on other YouTubers or whatever platform, like I would speak that way. Or I go to the local business after hours. We have business after hours every month at a different place here. And so I would go there and I would talk to people. A lot of people also see me on YouTube since I'm on YouTube. So they would see me out in the street and say, oh, well, I watch your videos or I saw whatever. But I'm going to be honest with you. Like I said, mainly it is word of mouth. People would, up until the other day, I had a provider who I did billing for probably, it was about a year. I think it was about a year I did billing for him. He was just doing surgeries and stuff and seeing patients in the hospital, and he hadn't opened his office yet. So I was just doing his billing that way. And then after he got his office, he decided to bring the billing in house, and he had his sister or somebody like that doing his billing. So we no longer, I no longer work for him, but it wasn't on bad terms. Everything was fine, because that's the other thing. You might not have a provider forever. It's not probably going to be, a lifetime or anything. And that's fine. And you don't have to have a bad relationship with them, because I just got a call the other day from a new provider who wanted to have me do their billing. And when I asked how did they find out about me, they told me it was from that provider that I had just worked for, just only for a year. So even in that way, it's word of mouth. Now, I didn't take on that client because it would have been too much for me. So what I did was refer that client to someone else that I knew who dealt with that specialty. So, I mean, it is possible. Just keep working, trying to do it. It will come. It will come. It might seem like forever, but it will definitely come. Is it very stressful and confusing? Is what very stressful and confusing? Doing billing for a lot of doctors at one time. I was talking, so maybe ask that question one more time so I could get it a little bit clearer. But yeah, it's possible. It is very possible that you could get a client. The AAPC, COC. Okay, is it the CPC you're talking about or the CPB? I think the COC is the Certified Outpatient Coder. Is that what you're talking about? Because if it's the outpatient coder that you're talking about, I did not do the outpatient coder because I did the professional coder, which is for professionals. Yeah, so okay, so the COC, yeah. I didn't do the COC. I did the CPB and the CPC and the CPPM and the CPBI. It's a lot of letters, but yeah, the COC I think is the outpatient coder. And so that would be more geared towards, I think, like facilities, the ambulatory surgical centers, stuff like that. So I do billing for doctors' offices, the professional fees. So it's the CPB and the CPC that I have gotten for myself. But how far? Let me read back and see. Oh, you're studying for it. Okay. So how far along, do you think you'll be able to get actually sit for the exam soon? Is it confusing for you? Because I know that they have, so AAPC has, I think, self-study, and I think they have one where you can actually have a instructor. So maybe you might need the instructor one. I always recommend CCO. It's cco.us. I'll also put their link in my description. It's an affiliate link. Doesn't cost you anymore, but I get a little commission off of anything you get. And I recommend them because they are really good. Now, I did a video on my channel that was comparing AAPC and CCO. And I mean, AAPC is the leading organization. AAPC is the leading organization for the certification part, right? But as far as their classes, because I took classes through them as well, I just felt like, I don't know, I didn't quite like their style. It was kind of boring. I'm like ADD all over the place, or ADHD. I'm like all over the place, and it was kind of boring for me. Then I found CCO, and I really liked the way, I think her name is Laverne. No, I lie, Laureen. I don't know where I got Laverne from. Laureen, and I really liked her style. And then they had like this monthly, I think it is, like a membership where you can ask questions and you can, kind of network with other billers and coders, and I really enjoyed that. So I always recommend their school when it comes to learning, billing and coding and stuff like that. I'm taking an independent study for AAPC. Okay, so I think you probably have, because I think I took the independent study as well. I think it was like 4 months I had or something like that. And I think you have a way where you could connect or talk to like the, I don't know if they call mentors or something, but you, like, if you have a problem. So just make sure that you use them. Utilize all the stuff that comes with that. So if you're having an issue with a certain chapter and you need, them to answer some questions, you're paying for that. Ask them to help you out with that. Do not not do it, because again, you're paying for that. And then if you don't complete the course within the time span, whether that's 4 months, I don't know if they changed it from the 4 months. I think it was 4 months for me. Then you have to pay more in order to extend that out. So make sure you do utilize everything that you can. Yes, I'm still a member of AAPC. It's been a while, and trust me, it can be expensive because I think at this point it's like is it 210? I think it's like 210 a year. So every year, mine is rolling up in January. Every year I have to pay the membership fee. Yes, 210, right? What? I got that. Listen, and it keeps going up, because when I think I started, I think it was like 100 and something, like maybe 150 or something, but that's been a while. I became a member of AAPC in 2013. That's what, 11 years. And so, everything goes up. So it's just been going up, going up, going up. And then I have 4, sorry, I keep forgetting the instructor one. I have 4 certifications. So I have to get CEUs and I have to get CTUs. Yeah, so the CEUs is for those like the CPC, the CPB, the CPPM. And I think I have to get like, I don't even remember how much, 40 something, 48, something like that every 2 years. And then for the CTU, I have to get 8 CTUs every year. They told that I have to maintain COC every 2 years and take the CEU. Yeah. So the CEUs, I think you have to get them every 2 years. So you have 2 years to get like, I don't know. I think if you only have one certification, I think it's like 36 CEUs. Sorry. And then as you get more and more, then the number of CEUs you have to get goes up. I did a video about that too. It's old and it looks ridiculous, but if you wanted to learn a little bit more about how much CEUs you'd have to get, I did a video about that, which needs to be updated. But yeah, so I don't know. Are you thinking about starting a billing business on the side? Or are you into billing already? Are you already a biller? Or anybody else on here too? Are you guys already billers, or what is your goal? What is the outcome that you want from doing this? Because I know for a while when I started out in billing, I really didn't have a goal. I was just billing. I have been billing for a while. So, oh, you was a biller. Okay. Did you not like that, or do you more like coding than billing? Because for me, if you haven't already, been on my channel, I love billing and I really don't care too much for coding. So that's why I jump deep headfirst into billing, and I'm not necessarily into coding per se. I mean, coding plays really close to billing. So, oh, you were laid off. Okay. Well, I mean, this is your opportunity. This is your opportunity to either go back into billing, branch out into coding, doing all of those things that you maybe wanted to do but wasn't sure that you could do. You can do it. I'll just say that. You just have to put your mind to it and decide what you want to do. I would say also, like I said, I'm going to do a series about this because I think I finally just really realized, like, I've been doing this for so long. And if up until maybe, I don't know, 2 years ago, if you had asked me, do you feel like you know what you're doing? Do you feel like, you're an imposter? I'd have been like, yep. And then sometimes right now I feel like that. But I had to keep pushing myself and doing what I know I can do, So whatever position you were, wherever you was working as a biller, if you really enjoyed doing that, or maybe you want to branch out to another specialty or different department, like if you do this COC, then you can get jobs in the like I said, ambulatory surgical centers, different places like that, outpatient departments in the hospital. You can do all of that, and that might be in a new area that you have not dealt with before. So use that as an opportunity to do big things, do whatever it is that you feel like you need to do. So I just wanted to come on and just see, like I said, what you guys feel about it, as far as working full-time, whether that is full-time as a biller or full-time in another type of job, and what's holding you back, because I'm going to do a series on from biller to business owner and try and give you guys some tips and some help. Again, I have remote one-on-ones where you can ask me questions. I have 45 minutes and 90-minute sessions. You can ask questions, specific questions that's customized to you, because the other thing with billing is that it's not a one-size-fits-all thing. And, you might feel like you're taking all of this advice or seeing all of this stuff from other people and all of that stuff. But again, it's not one size fits all. And you might have specific questions because each individual place has, different rules. Different specialties have different rules. I live in the U.S. Virgin Islands. We have different rules when it comes to, let's say, timely filing for payers. So I have a problem with that right now with a particular software that I'm using that I'm not going to mention, but if y'all watch my videos, y'all probably know who I'm talking about. But they kind of generalized everybody, and as far as timely filing is concerned. But in the U.S. Virgin Islands, we do things a little bit different. And so our timely filing is not the same as the timely filing for most providers in the States. So I had to let them know that, because billing is not a one size fits all. So again, if you decide to maybe open up or do like 1099 work, Penilis Williams, I don't know if I said that right, but I wanted to say your name because I'm seeing you the one speaking to me. But if you want to start a billing business, you can, even if you have to, you was laid off and you have to maybe get another job, not as a biller, for a while, you can also, work on trying to get your billing business up, do some things here and there and just try to get it going. And then you might be able to one day just do billing if that's what you want to do, or just do coding, or do a billing business where you're doing billing and coding in the business. Everybody's billing business looks different. Don't let anybody tell you what you should do and shouldn't do. In my billing business, I do not do eligibility and verification, and I do not do pre-authorizations. In other billing businesses, they may do that. But again, I'm the owner of my medical billing business, so I can decide what it is that I want to do and what it is that I don't want to do. Which when if you decide to, you can do the same thing. So everybody's billing business is going to be different, and you can get generalized information. You can get, customize it to you. Do not take on what other people want you to do, and it's not something that you want to do. Even something like, let's say you just want to be maybe a denial, do denial management. Now, I have a provider that I currently bill for, and not even, I do the denial management portion. So I don't do everything. I don't do the claim submission. I don't do reimbursement management. I don't do patient statements. I just do the accounts receivable management. That's it. And I'm fine with that. Again, then I have another provider that I do everything for. So you can be that person who maybe just have 5 providers and you just decide you want to do denial management for all 5 providers. Or you don't mind mixing and matching to say, well, this provider I do, AR management. This provider, I'm going to do everything. You decide. This is your business, so you decide. So I've been yapping them out for a half an hour already, and this was totally unplanned, but I thank you guys for jumping on. I will leave the links right now. As soon as I get off, I'm going to make sure that the links are in the description box, and I will catch you guys again in the next live. I was scheduling lives before, but I really don't. I don't know. They weren't doing that hot, and I just figured that maybe you guys don't like lives, but I like lives, and I like to talk to you guys and answer your questions. So I might start doing lives again, or I might just jump on like this. But if I jump on, I thank you guys for joining me, and I'm not going to keep up too much of your time. You can leave comments in the comments below if you have questions after this live, and I will surely answer them. I always answer all of my comments that I get. So I hope you guys enjoy your evening. I will be going to do some billing for my clients, and I will see you again in my next live and in my next YouTube video when I post it on Sunday. All right. Have a good evening.